Welcome back to Life Begins at 50. I'm Lee Espy, and as I said before, hair loss is one of the most difficult aspects of reaching 50 and beyond. But luckily, there's a wide array of options to help replace that hair, and New Hart is the leader in that area. Let's welcome Kathy Smith, president of New Hart, along with Dr. Mark Boles, New Hart physician. Welcome to the show.
Thank you.
And I have to say, Kathy, I don't know why I expected a man would be the president. Isn't that something?
No, actually, women, we're used to taking care of people. So for a woman, we take care of our children, our husbands. We're just taking care of people with thinning and balding problems.
So it really is a natural thing.
Natural.
And let's talk about this hair loss for men, because as we were saying, it is an age-old scourge.
Sure.
People that come to mind, Napoleon, Caesar.
Right. They actually said Napoleon actually had a comb over, so we've all seen men walking around with that type of thing. But it has been around for a long time, and I think as you think about hair loss, it's something that I feel most men look at it, they recognize it, they see it, they worry about it, they they really agonize sometimes over it. You may find the man who finally reaches the point where he says, I can live with my thinning or balding, but I think most of us tend to kind of be bothered by it. I know I did. I got involved in this business just because I was noticing at some point when I was in training, under a lot of stress, I was actually losing hair. So this has been the age-old problem, what to do with hair loss and then hair replacement.
Well, I mean, even the story of Samson, he loses his hair, he loses his power. So that's ingrained with us.
Sure.
And what does cause hair loss?
There's a lot of reasons, and I like to look at hair loss as being a multifactorial event, meaning that there's several causes. The biggest reason we lose our hair is because of genetics, and I've had people come in, they'll say, well, gee, Dr. Boles, nobody in my family has thinning or balding. But then when you start looking at it and you go back far enough, you actually wind up seeing it.
You have to look at the photographs.
Oh, you do. Or a lot of times you'll see a whole family, maybe 5 brothers will walk in, and everybody's bald, and the youngest one says, gee, Dr. Boles, what do you think is going to happen to me? What can you predict? But the biggest reason we lose our hair is over genetics. There's obviously a lot of other reasons, things such as nutrition. We see that we see in areas and parts of the world, because we have offices throughout the world.
Right.
So we see in particular countries, there is a higher rate of thinning and balding, again, because of nutrition. We know that a lot of medications will cause hair loss. 2 of the biggest medications that can cause your hair to thin are blood pressure medications, beta blockers, and then your anti-cholesterol medications. And
a lot of people are on this.
Oh, sure. It's very commonplace. We talk about life after 50. It's very common for us after 50. I used the word us. Maybe we shouldn't say that. No. But it's very common to find that everybody's on those type of medications.
Right.
But so medications can do it. We see, for example, we take care of women as well. So premenopausal, menopausal, around childbirth, we'll see thinning, hair loss
at that
point. Right.
And this is where New Hart comes in.
Right.
And you notice, and even if folks that are like you said, medications. So what do? They call you. So what's the first step?
The first step is a free private consultation where we determine if it's just natural male pattern balding. We're able to extract hair from a donor area, an area that is programmed genetically to grow for the rest of their life, and simply put it into the thinning and balding area. So it's a permanent solution to hair loss.
So is that a hair transplant?
Is that what that's called? There are several options for hair restoration. There are topical solutions like Rogaine. There's an oral medication, Propecia. There's hair systems or toupees, and then there's hair transplantation, which is a permanent solution.
And then you're taking a patch, or are you taking actual one piece at a time? How does that work?
Either way. There's a strip method of hair transplantation where a strip of tissue is removed from the donor area, or we can individually core out grafts.
Now, who wouldn't be eligible for a transplant?
Dr. Boles?
It really depends on several factors. The first thing is expectation. So if I have the 50, 60, 70-year-old that comes in that says, gee, I want to look like I did when I was 18, and he's completely bald, that may be someone who's not a suitable candidate. I always go back to the person that I had one day that came in and said he wanted to look like Elvis Presley. and this was a gentleman who, again, was in an advanced stage of thinning and balding. And so that was somebody where if you can't change his ideas or expectations, and he truly wants to look like Elvis, that's somebody that would not be a candidate, and you might want to walk away or refer him over for a hair system, wig, something along that line. So it's really, number one, expectations. Number two, this is really a situation of supply and demand.
Right.
Depending on what the supply is, depending on what the demand is, really determines what you can do. If somebody comes in and they have very, very thin hair in the back, he may not be a candidate for a transplant. Other things that fall into that are, again, there are certain diseases that may stop you from wanting to do surgery on this person. But I will tell you, this is such a simple procedure nowadays and a safe procedure. There aren't too many medical situations that stop us from doing hair transplants. So those are probably the biggest. I mean, it really does come down to expectation, supply, demand, that type of thing.
Well, how long does a hair transplant take? I mean, does this take time as you move your way across the head, or I mean, you have to wait and see if it grows? So how long is this process?
Well, the average procedure itself takes 3.5 to 4 hours.
Okay.
And it takes about 6 to 9 months for it to grow in, to really enjoy the full benefit of the procedure.
So you're doing the whole transplant at one time, and then you're just waiting to see how it grows. It's like planting a garden in a certain way.
You are. Now, some people do want a second or third treatment session, but that's up to them. We try to take, our approach is that we want to give them one session that will look natural, will be a great improvement, even if they don't continue and have any further work done.
Now, Newhart is a name that we've known for years and years. Tell us about the company. It has.
Right.
It really has. It's a very familiar name.
Right. Newhart was started here in Pittsburgh in 1986. Then we started other offices through the U.S., like New York, Chicago, Atlanta. Right now we have 10 clinics. We're in Dubai, Hong Kong. We're opening in Europe. We're in Puerto Rico.
Does it seem that the baby boomers, though, they are having the hardest time of any generation I can think of with baldness? It's that, but it's the youth. It is. It's the youth generation. I mean, this. We had the long hair in the 70s.
Right.
Well, do you see more?
Absolutely. I ask clients every day, why would you like to have this process done? I'm trying to understand. And there's a variety of reasons. Either, let's say a man got recently divorced and he's re-entering the dating scene and he wants to look good. Or he looks at himself now and he's 60 years old and he sees some of the people at work, they're in their 30s, and he just wants to really stay attractive and young looking in his game. There's a million different reasons why a man in his 50s, 60s, and older gets this process done. I asked a client, Mike Hosick, he was the drummer for the Doobie Brothers. I said, my gosh, you have fame, you have money, you had all the women. Why do you want hair transplantation? And he said to me, why not?
Yeah.
And in fact, on that note, hair restoration is really only one step in what we see our clients following through with other self-improvement.
Do you notice
steps.
that?
Absolutely.
Yeah. They start to feel a little more vital, and
you'll get the guy that'll come in and his hair grows. All of a sudden, he starts looking better in that perspective. Now he's out working out, and we'll get these 50, 60-year-olds that'll come in, and they look wonderful. Now they've shaved because they, a lot of facial hair to make up for their hair loss. Now their hair's growing in. They're shaving. They're working out. They're running. They're dating. I mean, it makes a huge impact on somebody's life.
Also, want to make sure that we have your website. What is your website?
www.newhart.com.
Just like it sounds, just as easy. And never knew that it was started here in Pittsburgh, and you're everywhere. That's a wonderful.
We're everywhere.
That's a wonderful story. Well, thank you so much.
Yeah, that's right. We continue to grow.
Continue to grow. Thank you so much for being here.
Thank you very much.